Hi, I'm Sondra Sage. I live in Canyon City, and I live with complex post-traumatic stress disorder and depression. 10 years ago, I experienced a severe life trauma which resulted in both a panic attack and a dangerously increased blood pressure. Because the physician in the emergency room where I sought treatment for my blood pressure didn't understand when I explained that I had PTSD and was experiencing symptoms that would pass with time, I was forcibly sent to an inpatient setting. While in this hospital ward, I was drugged with a strong combination of psychoactive medications, none of which was later determined to be needed, until I could barely walk or speak, and was subjected to dehumanizing treatment which traumatized me completely. This experience has made it difficult for me to seek healthcare treatment, since it triggers my anxiety. Though I have since received treatment from many helpful providers, I still struggle with seeking healthcare due to triggers associated with this event. As a result, when I am most in need of help, it's almost impossible for me to seek care because in that moment, I am most incapable of dealing with the terror I feel around seeking health care. When I endured this traumatic event, I was living in a rural community with limited mental health treatment options and was sent by ambulance to a hospital nearly 2 hours drive from my home, my family, my friends, in essence, my entire network of support. I know firsthand what it's like to be locked into a facility so far from home that even your family can't visit often. To be isolated in this way is actually counterproductive to recovering from a mental health crisis. Connection with others is the true cure for mental health issues, though it is difficult to achieve in a world which displays ignorance and prejudice toward mental health challenges. I've learned that what I really need during a crisis is for someone to simply be present with me in a compassionate and respectful way. I've lived with my conditions for decades and have a whole arsenal of knowledge and coping skills. Unfortunately, I don't have a great capacity to deal with excess stress, and I'm easily overwhelmed. When I am symptomatic, I just need a little understanding and patience. Unfortunately, most people don't know how to deal with a person in mental crisis, so I usually get either someone telling me to get over it or someone trying to fix it. The power of the support of my peers who have lived through similar struggles is that they are the people in my life most capable of being present and supporting me without judgment. I would like to speak for the idea of allowing more peer services within the mental health system. This would both provide me with the kind of support I truly need and would help address the shortage of mental health providers, especially common to rural areas. When the day comes that I require help to get through a mental crisis, I would very much like to have the option of a peer-staffed respite facility in my county so that I do not need to be isolated from my support network by going to a treatment facility far away. I dream of a future where every rural county in the state has a peer-staffed respite facility so that there is an alternative to being isolated and locked into a hospital ward to be pumped full of too many drugs so the overworked staff can keep control of the patients under their care. If a peer respite facility existed in my county, I would not be afraid to ask for help if I needed it. Perhaps others might feel the same. People with mental health issues would like to be treated with the same respect and dignity given to those with physical problems. I would also like to advocate for more education about mental trauma among medical professionals. For example, while it's been almost 30 years since the original adverse childhood experiences study showed the long-term mental and physical effects of traumatic experiences in childhood, I have yet to find a medical provider who fully understands these important concepts or incorporates them into their diagnostic practice. Although there is a preponderance of current science to support the effectiveness of mental health treatments other than standard pharmaceutical treatments, most of the more effective alternative treatments are beyond the means of a person living with mental issues because they either are geographically unavailable or are not covered by insurance companies. This situation needs to be addressed so that the most modern treatments are available to all who need them. Thank you for your time.